So stretching, I get asked the question so often, does it really help? What does it really do? Why should I be stretching? Well, as a coach, there's reasons I would want somebody stretching. As a physical therapist, there's reasons I would want somebody stretching. But here's just some statistics for you. There are research studies that show that if people stretched properly, about 40% of injuries, whether that's in athletes or just people that are running, but 40% of injury wouldn't occur if we were stretching and stretching properly. And then there are other studies that show about 60% of just the pains and the aches and the stiffness and soreness and all that stuff that we experience as a result of activity, etc., that if we were stretching again and stretching properly, that about 60% of the time we wouldn't have those problems. So, does it really matter? How does it help? What does it do? Well, the main function of stretching is that stretching takes tissue, whether it's muscle, tendon, ligament, skin, other things, and it lengthens it out. Now, as we'll talk about in a little bit, there's a couple of different types of stretching, but the purpose of stretching is that it lengthens it out. And so when it lengthens it out, it makes it easier for that body part to do whatever the activity is that you're doing. Whether you're sitting at your desk and trying to hold good posture, or you're raking leaves in the yard, or you're going for a 25-mile run, the longer that a muscle is, the greater that it is able to perform its activities. So let's look at a couple of activities. If we look at somebody that's sitting at their desk, well, you are sitting there for even 30 minutes. If you're sitting for any period of time, the muscles in your neck, your upper back, even your lower back are having to work to hold your body weight. So as they're working, those muscles are gradually getting shorter. It doesn't happen right away, but they're gradually getting shorter. Studies show, and we know, that muscle that is shorter is less capable of working. It's less capable of moving more weight. It's less capable of doing something for a longer period of time, and it's less capable of doing something repetitively. So the longer, the more stretched out that a muscle is, the better able it is to do that activity. So when you're sitting during the day and posture or gravity is gradually pulling you forward, what's happening is you're getting an increase in pressure in through here. So stretching is going to help to bring you back into a good position, open that space back up and get pressure off of the nerves and allow for there to be less pressure on your head, less headaches, etc. If we look at a runner, somebody that wants to go out and run 5 miles, well, when you're running, you're taking a longer stride than when you're walking. So the longer the stride that you can take means you'll be able to run faster, you'll be able to get it done sooner, your time will be better, you'll get more out of the run, etc. So the longer the stride comes from the fact that the muscles down the back of your leg would need to be able to be longer and stretched out to get you to be able to take that longer stride without risk of injury or without the stress and strain that's going to happen the next day. So even if we look at just bending over to tie your shoes, well, when you bend over to tie your shoes, if you don't have the motion or the flexibility in the muscles in the back of your leg, whether you're sitting or standing, it doesn't matter. If you don't have the flexibility and the length in those muscles, well, then what's going to happen is you're going to have to get it from someplace else. And so oftentimes as a physical therapist, I hear somebody tell me, I was bending over to tie my shoes and I felt this pull in my back. Well, the reason for that was that you didn't have the motion, the flexibility in the muscles in the back of your leg. You had to get it from someplace else, and you overworked or overstretched a muscle in that area. If we look at just how a muscle helps you with fatigue and just activity in general, a stretching activity is going to help that muscle, again, to be longer. It's going to help it to be able to perform for a longer period of time. So again, whether you're sitting at your desk or you're going for that run or you're raking leaves in the yard, we know muscle is going to gradually get shorter as the day goes on, as activity goes on. Therefore, the longer you start it out, the better off it's going to be. So how does stretching work? Well, it really has 3 major functions. It has 3 things that it does. Number 1, it prepares your tissue, again, whatever that is, muscle, tendon, whatever it might be, it prepares it for an activity. It prepares it to be able to sit at your desk for an hour and work on that project. It prepares it to be able to go for that 26-mile run. It prepares it to be able to garden or whatever it might be. Like I said, it lengthens that muscle out. It makes it in that longer state. The second thing, and really where we start to use stretching as a treatment technique, is that it reduces the amount of pressure on things. So if we're talking about a trigger point, for example, I have this trigger point, I have this pain, or I get this pain in my shoulder. Well, what's happening is something's getting pinched on, and most likely it's getting pinched on by the muscle. So that trigger point is actually a nerve that's being pinched on by the muscle. The muscle is pinching on it because the muscle is tight, it's too short. That pinching, that pressure, yes, it causes the pain. It also reduces blood flow to the area. It increases the amount of carbon dioxide that's building up in a muscle, etc. And that's what causes that pain, that stiffness, that soreness, etc. And the last thing that stretching does in that third function is that it helps to facilitate recovery. So again, let's say we have an athlete that's gone off and played a basketball game or played a soccer game. All of their muscles in their leg and their arms, whatever, respective to their sport, are going to be a little bit tighter. It's going to, again, restrict blood flow. So that tightness allows for the buildup and the staying of carbon dioxide and other waste products from the activity that they just did. That's what causes what's called delayed onset muscle soreness. Tomorrow, that muscle is more sore because it didn't get good blood flow through it, pick up all of that carbon dioxide, deliver oxygen to the area, and help any traumas that occurred with the activity or whatever it might be to recover. So again, a great example, you're out in the yard gardening today. Today you feel okay, you're a little bit tired, fatigued, but tomorrow you wake up and you can barely move. That's that delayed onset muscle soreness. Over that 12 hours time, those muscles got shorter, the carbon dioxide was stuck there because the muscles didn't allow good blood flow, and now tomorrow you're much more sore than you are today. So again, it helps with recovery. What are the two types of stretching? If you're paying a lot of attention to stretching right now, you're probably starting to hear a lot about dynamic stretching. Dynamic stretching is great. It is a method of preparing the body for a specific activity. So I'll just use, as a soccer coach, I'll use it as an example. At the beginning of practice, I will have my soccer team do a lot of dynamic stretching. It's stretching and movement that involves stretching and trying to lengthen muscles out specific to the activity that they're just getting ready to do. If you've ever seen a swimmer standing on the blocks like in the Olympics and they're making those big giant arm swings, that's dynamic stretching, because that swimmer is getting their muscles ready for the activity they're getting ready to do for the next 45 seconds, the next 5 minutes, whatever it might be. But dynamic stretching does not replace static stretching. Everybody should be static stretching every day. Whether you're an elite athlete or somebody that doesn't participate in activity at all, you should be stretching every muscle in your body, major muscle in your body, every day. So again, use as an example somebody who's sitting at their desk. You want to make sure that you are stretching neck muscles, upper back muscles, shoulder muscles, because those are the muscles that are going to get tight and pull you into positions that are going to, over time, lead to pain. So static stretching is what prevents injury and allows there to be less pressure, and dynamic stretching is what prepares a specific body part for a specific activity, but both of which are things that should be incorporated into anybody's stretching routine. So we really get to the point of why would somebody want to be stretching? Well, number one, like I said, it prevents injury. Number two, it allows for recovery. But if you're experiencing any stiffness, any soreness, any pinching, any tightness, any popping, any cracking, that's a sign that either the pressure on a structure or inside of the joint is too great, or that the muscle isn't allowing a part of your body to move the way that it should. So what we need to do is make sure that we get you on a stretching program that's specific for you. As part of a physical therapy evaluation, we're going to look at specific movements. We're going to look at how you're doing things, and we're going to apply what needs to be stretched to your specific condition, as opposed to you go onto the internet and you've got a hip problem and it tells you should be doing an IT band stretch. Well, that might be a stretch that you need to do, but the question is, what's really causing that IT band to get tight? That's what else needs to be stretched, and that's really where we would come in as expert physical therapists. So again, stretching, something everybody should be doing all day long. Make sure that even if you're, again, not an active person, stretching should be a vital and an integral part of your day, because it will put you into that category of 60% of the time, it reduces the possibility of stress, strain, pain, stiffness, etc.